to our guests today. So joining us today, I'm really pleased to say that we've got the founder and developer of SimEPR, Dr. Arron Thind, and he's going to be talking us through the functionality of SimEPR, why SimEPR, why it's needed, and how you can best use it in your practice. But I'm also really pleased to be joined by Lindsay McLeish from Buckinghamshire New University. She is already a user of SimEPR, and she's going to talk us through her experiences of SimEPR and how she's embedding it into her practice at her university. So we've got quite a few people in. We'll just give them a few more moments to jump in, and then we will get started. So the first part of our webinar today, as I said, is with Arron. So a very warm welcome to you today, Arron. Thank you very much for joining us. So I guess the first thing is to sort of be good to kind of introduce yourself and explain to everybody how you kind of got into the world of healthcare simulation.
Yeah, sure. Thanks. Thanks for the introductions. Yeah, I'm Arron. I'm a GP based in London. And I think the best way of really putting together the story, as well as talking about SimEPR in terms of its functionality, is probably through this presentation that I put together. And we can also go through a live demonstration where people can also see it live in action and really see how it could be put into your own practice as well. So I'm just going to hit share. And you should see a presentation showing up. Okay. So yeah, like I said, I'm a GP, so I'm clinical. And one of the things that I found was that simulation was some of the most valuable training I had throughout my career or throughout my training. But one of the things I found was that as soon as I finished my studies at university, left university, went into the real clinical world, I realized that all this simulation training that was hugely valuable was all on paper. And actually, what I was really doing was using computers. If anything, I was using a computer more than I was actually interacting with patients. So I found that there was this digital discrepancy between what we're doing in training versus on the front line in real practice. And so essentially, the idea for SimEPR and the initial kind of mission behind SimEPR was going from something like this to a setup like this, which is more representative of true clinical practice. And with that came a few other things. So not only were we using SimEPR to build a digitally ready workforce by incorporating digital skills into practical training, it also creates a higher fidelity training experience. So it's supporting the creation of an environment that more replicates true clinical practice. And we've even got feedback data that I'll talk about in more detail in a moment, which has demonstrated higher fidelity training compared to conventional paper-based training methods using simulation. And as well as that, SimEPR has been demonstrated to save staff time and resources. And you can make use of various tools, which we're going to demonstrate later, such as the automation features, various educational and debriefing tools, as well as analytics, scenario sharing, simulated wards, and so much more. So it's something that has positive benefits for both your students as well as your staff as well. And this is what SimEPR looks like. It's essentially an electronic patient record system that's specifically designed for medical education, and it replicates a lot of the key features you'd expect on an EPR system. So whether that's notes, drug charts and prescribing, observations, and so on. And it's a web-based app, so you don't need to physically install it on any devices. So any computers, laptops, iPads, and if you're using the SimWard package, you can even use mobile devices. Any of these devices that's connected to the internet, you can run SimEPR through the browser. And it's more just a clinical EPR system, which is a really important thing I want to get across. Even though it's called SimEPR, there are a lot of features that distinguish it from a real clinical EPR system. And there are lots of tools and features that are specific to education. And using the editor mode, you can build your own scenarios. and save time building those scenarios using our automation tools. So you can generate days worth of observation results at the click of a button. You can also auto-generate investigation results with particular abnormalities, for example, blood gas results with a acidosis, for example. And then those of you who are interested, this is more for universities or simulation departments on a bigger scale. SimEPR also has a SimWard feature, which allows you to build simulated wards of patients where you can monitor the activity of multiple trainees who are interacting with multiple patients. And over time, SimEPR has grown geographically. There's some really great clients across the UK who are now using SimEPR. And we've also got a university up in Australia, so University of Adelaide, which was really, really great to see. And along with that has come some absolutely fantastic feedback. I'm sure Lindsay will have a lot to say later, but we've also had feedback from other faculty as well. So this is Helen Flanagan from Brighton Sussex Medical School. Gemma from UE as well has had some really great feedback, especially highlighting the cost and time savings associated with using SimEPR for simulation. And some fantastic feedback down under from Adelaide, University of Adelaide, Adelaide Health Simulation, about how SimEPR has been an integral part of their delivering their simulation training. And I mentioned that we've also had some feedback from trainees as well about how SimEPR creates a more realistic training experience and augments clinical learning. And this was a study that we did a few years ago in collaboration with Health Education England South East, where we did a regional pilot and trial of SimEPR, where 200 trainees used SimEPR as part of their routine simulation training, and we collected feedback data from them. And from them, 86% reported that SimEPR created a more realistic training experience. 83% reported that SimEPR helped augment their clinical learning, which was really great feedback to see. So at this point, you're probably thinking, right, I want to see SimEPR in action. So let's go and do that. So this is, there are three essential components of SimEPR. You've got the simulation mode, which is essentially the EPR that trainees are interacting with on a computer or a tablet at the mannequin's bedside. And trainees will use this information, or students will use this information along with the physical history and examination to gather information, treat the patient, and so on. And you can do all the things like documenting, prescribing, requesting, investigations, reviewing notes and observations, and so on. All those key things you would do as part of real-life clinical practice or simulation training as well. So what you should see now is a patient record system here. Let me just navigate back to, yeah. So you should see SimEPR here. You can see that it's running through the browser. So this is nothing that needs to be installed. It just runs through the internet, any internet-enabled device. And I'm going to click on a patient record here. So this is the simulation mode of this scenario. So this is essentially what the student would be seeing on a computer, say at the mannequin's bedside. And you've got the patient details here with some general information. All of this information can be customized in the way that you want when you build your scenarios. And you can add your own toolbar where you can add various different guidelines and tools to support the decision-making of your students. There's notes that can be browsed through, and all the dates and times of any notes, results, and so on are all relevant to now, and they automatically update with time. So when you build the scenario, you'll never have to go back and manually update the dates and times. It's designed to automatically update. So this is a night entry that was done 4 a.m. today. Even if you were to run this scenario again in 2 weeks, 3 weeks, a year's time, that note will always show as today at 4 a.m. So you'll never have to go back and manually update the dates and times, which could save you a huge amount of time. You can document notes either as a blank entry, and trainees can also document using these assessments. So they're kind of pre-formed forms that can be filled out. So for example, this AMTS scoring system. Just add that in so you can see what it looks like. So I've just added the AMTS, and it even gives students a little bit of extra help, for example, how to interpret the scores as well on various different things. Then we have observations. They can be viewed in chart form. And it automatically calculates the new score. Depending on the patient type, there are different scoring systems, so Pews, News, and we've got ICU style observations. We also have Muse as well for maternity, and Newt for neonatal. Trigger and escalation information. Charts, so there's various different charts. This is a cannula chart with the VIP scoring. But there's a few other things like for neonatal, maternity, partograms, anesthetic charts, fluid balance. And then we're navigating to the investigation, so blood results, radiology results, bedside tests like ECGs or urine dips. This is a screen that allows your students to request investigations. So let's just request some basic things. So there you go, I've just sent a request for a few tests, and you can see that I've requested them here. This screen is for referrals. You can see there's already a pending referral that had been made. And then we have the drug chart. So from here, you can prescribe medication. You can also mark the administration of medication as well. So all the key things you'd expect to do on a normal EPR system, and so on. Okay, so that's a tour of the simulation mode. And that's what the student would be using, say, on a mannequin's bedside in the simulation room. What you would be using as faculty is the controller mode. So at the same time, while the student is using their device, you're able to monitor their activity. You can get a live stream of any actions that they're doing, but you can also push results for them to review. So you can set, when you design scenarios, you can set specific results like blood results, X-rays, ECGs, and so on to be hidden until you decide to show it to them. So that means you can get this kind of dynamic interaction between the trainee and the educator. So for example, in this video here, you will see that, in this video here, you'll see that on the right-hand side, on the trainee's view, there are some tests being requested. And then straight away, these pop up on the simulator's view. So this is what the simulation faculty would be seeing on their screen. And then after a certain time delay, those results can then be pushed to the student. So you review the result and then click push. And then you can see the student gets a notification that those results are back and they can action the relevant management. So if I navigate to this screen here and click on the controller, so this is I'm activating the controller for this scenario that we had just been running. And you can see those tests that we requested are currently here. And we've got some results that we can push to the student. So this is the dashboard where you get an overview of everything. You can read information about the scenario and instructions. So when you're building the scenario, you can design all of this. There's a log of everything that's happening. This is just another screen for pushing results. It's identical to what's on the dashboard. And this is a section where you can document any notes. So if I were to bring this across here and then move this side by side so you can just see them interacting together. What I can do is I can push some results. So let's say it's been a few minutes since this blood gas was requested. I can select a result, review it, click push, and then straight away, the student gets a notification that there's a result to review. So if we go into tests, blood gas, you can see there's that new result that was done just now. And there's the results. If you wanted to, you can also create a result on the fly. So using this magic wand, let's say we wanted to just do a venous blood gas with a particular abnormality. Just like that, you can push the result and they'll have that result straight away to review. And you can do that with laboratory results, radiology results, ECGs, urine dips, and so on. And at the end of the simulation, you can generate a log of all the trainees' activity as well. So what you can do is, once the scenario is ended, you can generate a PDF document that you can use for debriefing, or you can even give to the student for them to use in their portfolio as well to demonstrate any capabilities that they've demonstrated as part of their simulation. And then you have the editor mode. And this is the interface that allows you to build and customize scenarios in any way that you want. So you can, it's a completely blank canvas for you to build your own scenarios in any way that you see fit. So whether it's a patient having a heart attack, or it's just a patient just sitting on a ward and there's not really anything emergency-wise going on with them, it's just a kind of routine day-to-day simulation, you can build the scenarios in the way that you want to achieve specific learning objectives. So if I go into one of these scenarios, the other thing I should mention as well, at the end of the simulation, everything gets wiped and reset. So unlike paper, where you'll have to either reprint everything out or rub everything out, SimEPR takes care of all of that for you. And at the end of the simulation, everything gets wiped back to its default state. So your simulation is the scenario is ready for the next simulation, whether that's in the next 5 minutes or in 2 weeks' time. You never even have to think about manually resetting things. That gets taken care of for you. So let's just go into the editor mode, just so you can see what it looks like. So what I'm going to do is create a new patient. And basically everywhere where you see pencil icons are things that you can edit. So you can modify the patient's details. These are instructions for the scenario, so they're kind of faculty instructions, summary of the scenario. You can use our instructions template to pre-fill the scenario's instructions for faculty. You can modify all this information on the screen. So this is the first screen that would be seen by the student as they access the patient's record. Any notes, observations, and so on. And one of the things that is really popular among users of SimEPR are some of the magic features. So pencil icons are things that you can modify. Magic wands are what we call the magic features. So if you click on this to generate some observations, you can say, okay, the patient was admitted 3 days ago. I want observations to have been taken 4 times a day. And at the click of a button, you've got a series of days worth of normal observations that you can then individually modify if you wanted to. So that could save you hours worth of time building scenarios. So let's say we just change a few things here. And that can all be viewed in the chart form as well. And I mentioned about using the magic features to automate creation of blood gas results. Similar, you just click the magic wand, select the abnormality, adjust the severity using the slider, and there you go, you have some results that can be shown. So that's how quick it is to just modify scenarios and create them in the way that you want. There's a lot of flexibility. Now, what I've been showing you so far is the what we call the SimEPR Basic, which is a single simulation mode on SimEPR that SimEPR has to offer. So if you imagine a simulation room where you've got a single mannequin, let me just make it full screen. So you've got a single mannequin and a computer beside the mannequin. You have an interaction that's a little bit like this on the left-hand side, where you've got faculty monitoring the controller and one device in the sim room. We also have our standard and plus packages, which includes SimWard, and that allows you to basically build a simulated ward of patients where you can simultaneously monitor the EPR activity of multiple trainees interacting with patients. So the actual scenario, simulation mode of the scenario looks identical. It's still the simulated patient record. So from the student's perspective, it's pretty similar. But the difference is that you're able to monitor what's happening across every patient and every student within that sim ward. So if I just show you this test sim ward that I set up, when you create a sim ward, you will create a temporary login. So you give that login to the student. At the end of the simulation, that login will be wiped and reset, and there'll be a new one that's created. But this is a temporary login that student uses to log in, and they will then enter their name and their role, and then any activity they do on any patient will get timestamped under that name and role. And then you as faculty can monitor what every student is doing. So I'm now this is the controller for SimWard, which looks a little bit different to the one that I showed you for this SimEPR basic, the single simulation mode, but conceptually it is the same. You can review all the activity that's happening with all the patients. You can imagine this can get quite busy when there's a lot of students and a lot of patients. I should mention you can have up to 15 patients within this sim ward. And then you can monitor the activity that's happening on each patient. You can go directly into the EPR to view the EPR. You can change the patient's location, so you can even move patients around to simulate the flow of patients. You can push results. So you've got the same screen where you can push results to students. And then you've also got the trainee view. So you've got a view of what's happening in terms of the broader patient perspective. And then you can also see what's happening, what each student is doing at the same time as well. And this screen allows you to directly message any individual students, or you can send a message to all of them. This can be to alert them of new results. It can be to alert them of for example, a 222 call on a specific patient who's becoming unwell. It could be anything you want it to be. And then just like with the single simulation mode, the basic mode, this also resets as well. So at the end of the simulation, you click the end session button, it will wipe all the activity back to its default state so that it's ready for the next simulation to run. So again, takes care of the whole process of generating the scenarios for the simulation and then wiping it back to its default state at the end. So I think that's everything I had to cover. Interested to hear if we're going, well, are we going straight to Lindsay, or are we answering any quick questions at all?
We'll go straight to Lindsay, and then if anybody has got any questions from Arron's presentation, there was a lot covered there, all really fascinating. Whether you've got a question about SimWard, or we've got a question about SimEPR Basic, Arron will be here right to the end. So if you've got any questions, either pop them in the chat or pop them in the Q&A box, and we'll come to them the end. But yeah, thank you so much, Arron. That was really, really insightful and really useful, I'm sure, for our attendees to listen to. So right now we're going to hand over to our other guest. So we're very lucky to be joined by Lindsay McLeish, who is the Head of Sim and Skills at Buckinghamshire New University, and she is a current user of SimEPR and has been using SimEPR for quite a while. So first of all, Lindsay, can you give us kind of an idea of your simulation setup at your university and the courses that you're offering?
Yes, thank you. So yeah, what we are doing at Bucks University, we do mainly pre-registration training. So where I have been using SimEPR is with the pre-registration nursing students currently. Other courses we offer as well are sort of CPD courses, and we're just very much in the early stages of rolling out SimEPR to them. And the sort of simulation that we deliver at Bucks University, mainly for the pre-registration nursing students, is simulated practice learning placements. So to replicate real life clinical practice. We're bringing them into university to be able to have a placement as opposed to being into the clinical area, to help reduce placement capacity and also to sort of replicate some of those sort of real life clinical scenarios in practice. And the NMC allow us to give up to 600 hours of that. So that's what we're currently doing at Bucks University.
I know some universities are delivering SPL as you are, but for anybody that isn't doing simulated practice learning at the moment, what are the kind of the core differences in how you are facilitating that compared to other simulation that you do?
So how we're doing that is to try and make it as real life as possible, and we do it in different stages. So we do actually deliver our simulated placements to all stages of the pre-registration nursing training. I know different HCIs are doing it differently, but we are doing it in stage 1 up to stage 3, so all the way through the years. And what we do is we tailor the SPL depending on where they are in the program. So for example, our stage 1 SPL tends to be more based around that sort of prep to practice. So I'll design simulation around things that I think they're going to encounter for the first time before they go into placement. So they actually have their SPL before they even step foot onto a ward. And what I will do is design sort of simulation which is on those sort of more basic nursing skills, such as, you know, personal hygiene, being able to take vital observations, assessing patients and stuff. So that's how we're sort of delivering that.
And so you've been using SimEPR as part of your SPL delivery for a couple of months now. What is the impact that you're seeing from having SimEPR?
Yeah, absolutely. So the way we've been using SimEPR, I've used it in both ways, Arron's explained, with either in that sort of scenario mode where you've got your mannequin and the SimEPR. But the best way I found to use it is I've used SimWard. And how I did that. So for my year ones, what we did is I basically ran a whole ward for a week. So in our facilities, we've got a huge sort of simulation lab that is built as a ward. So I ran 2 bays with 8 student nurses in each bay. And both the bays were exactly the same. So the same amount of patients in there, same patient, should I say, in there. I just duplicated the bays in order to keep the group small. And then I used SimEPR to run the ward. So what the sort of things that I did was I had 4 patients in the sim ward, like I say, both in each bay. And then I would put loads of different patients through that as well. So I would have some admissions, I'd have some discharges, and SimEPR was, I just wouldn't have been able to do that at that scale without SimEPR because it takes away, and I know Arron's explained a lot of the benefits about it, but what it massively did was reduce the workload I needed to be able to create those scenarios and still keep it so realistic as possible. So when, you know, I was doing a admission to the ward, I was actually getting the students to then admit, and I would actually bring the SimEPR on my laptop and pretend, say for example, I was the theatre nurse and I was handing over to the nurse in the bay, the student nurse in the bay, with SimEPR and using it and saying, right, now I will transfer that patient onto your ward, for example. So that's how I was using it in there, and it just made it so much more realistic. And like I say, reduced my time to be able to not have to create all those documents that you need to keep your simulation realistic as possible, especially when we are taking students out of the placement area and bringing them into HEIs. We want to keep that really realistic. So yeah.
And that is one of the things that a lot of universities have reported, is that SPL is quite a time and resource intensive investment that you're going to have to make. So as you've already said, with SimEPR, well, not having SimEPR in place, would none of this have even been achievable with thinking about the resources and times that you would have to use to put it in place?
Yeah, no, you're absolutely right. It would, like I say, massively reduced me being able to, so it's like, especially to keep it so what's the word I'm looking for? Just to keep it so sort of realistic. So, you know, if I would put an inject in, say, you know, the patient did deteriorate, and then they'd say, right, I'm going to go and do a blood gas. It's so, sometimes when you're in that moment, you would have to think about, when you've not got something like SimEPR, like, all right, what am I going to just, you know, try and put your clinical head right back on and thinking, okay, now I need to think about, you know, like a type 1 respiratory failure. But SimEPR gave me the beauty of just being able to go, I don't really even ask me to think that, that's going to give me the blood results, and then they could respond to that. And what it allows you to do as well is, when you had that magic button that Arron sort of explained, is you could just pick out elements of that blood gas, you know, to especially to focus it around the learning of the students that you had in there. So you can literally scale up with it and scale down. And like, you know, by the end of it, they got so used to reading what a normal HB was, for example, and that's great. That's the learning objective that they've achieved. So yeah, so things like that is how.
And you're using those pre-written templates that are in there with the patients, or have you done a bit of a mixture of using the wizard to be able to build your own scenarios as well?
Yes. So I've actually built all my own scenarios. I think I might have used one of Arron's once when I went all of a sudden I was like, oh, I just need to throw a new admission in there. So that was perfect because it was literally I could just admit him to the sim ward. But I've created a lot of my own scenarios, and the thing why that's really important is how simple that is to do. We all know the main thing, one of the massive barriers with delivering something like SPL is resources and the time it takes to be able to create scenarios, think about the injects. It takes me next to nothing time just to literally fill in the details, and then be able to create the scenarios that way as well. And now because I have those scenarios as well, they're always set onto SimEPR. So even if I create a different sim ward, I can go, oh yeah, I've got that patient actually, you know, who came in with a chest infection. I'll just admit that one to the ward. So they're there and they're so simple to use. And I think what's really important to say about that, I've not had any sort of what I would call formal training without using SimEPR. I've had demonstrations like Arron showed me there, and I've been able to teach myself how to use it. And of course, the training and support's there. I know if I need it, but I've not felt I've massively needed that. It's just so intuitive to use and quick to learn. And even with my students, throwing it out with the students, I literally all I do is have a PowerPoint presentation of the SPL for the week, of the plan for the week, and then I'll throw a slide in there. And, oh, we're going to be using this SimEPR. Give them a quick tour of like how you do it, how you request results from me, etc. And then just let them plug and play. And then I'll start them off at 10 o'clock in the morning. By lunchtime, they're more efficient than me. I putting loads of requests in saying, oh, I need this blood gas now. Oh, I've asked for an OT referral. So yeah, so they were really effective in using it.
That's going to be my next question. Well, it's two questions combined into one, because often one of the issues that faculty may have with onboarding a new software system is that difficulty of trying to get that buy-in from faculty, that you need to have everybody on board being able to use it, finding it really accessible to get the full use out of it. But on the other side of that, you also need it to be something that your students feel comfortable using as well. So have you found with both faculty and students that they're adapting to it pretty quickly?
Yeah, absolutely. Again, I've not delivered any faculty training as such. I literally would say, you know, come 15 minutes before the day and I will just show you quickly how to use SimEPR. And then literally they'll just watch me use it a bit because it is so intuitive to use. It's so simple. Once you get your head around, and especially if you think the first time I used it, I suppose you could argue a bit more the complex way with the sim ward where I've got 4 scenarios running at once. It's so easy to use that they just come and like, they have a little bit of a click around and a play and they soon get used to it. And the thing is as well, with the students, I think the feedback has always been so positive about it because it is so simple to use. We know we're getting a lot more international students now that might not be so used to using platforms like this from the countries they've come from and stuff. And that was the big driving force actually for me looking into something like SimEPR because of feedback from practice partners about our students not being digitally ready for clinical practice. And so me being able to use something like SimEPR, you know, I think and I've used, because of my background, I've worked in lots of trusts around in the NHS that have all used different things, you know, such as CareView or, you know, other different systems. And I feel SimEPR is so broad that it replicates pretty much anything you could go into a different trust. There's all aspects that you can take. So with the question with the training, especially most faculty members will have used something in clinical practice like, you know, a digital platform that they can just pick it up and go with it. So massively is, you know, real benefit to that.
You said earlier on that you used SimEPR in your SPLs, the placements at university before the students actually go on to placement. So have you had any reports back from either the students or the trusts that you work with that they're seeing a noticeable difference with the digital skills that the students are coming with when they go into placement?
Yeah, absolutely. Because I'm actually doing some research at the moment about, does SPL make a difference to, you know, students in reducing patient safety and things like that prior to going into placement. And one of the big things, feedback from the practice partners, was all this, you know, and how, like I sort of just alluded to, why I looked into something like SimEPR was about our students don't know how to do DATEX reporting. You know, they don't know how to, you know, document clearly like an initial assessment and things. So I did loads of making them just create note templates on there and saying, right, you write me a good A to E assessment and then I'll review that at the end of the day. And even with that, you know, they went into practice, and I have had practice partners come to work with me on the SPL where I've been using SimEPR, so the practice educators from the trusts, and they were saying, you know, how fantastic it is, and that they had noticed a difference in, you know, because we've only been delivering SPL for about a year. And so if I think about the students that we've had, you know, now to what we've previously had, there's just a marked difference in their sort of confidence, I'd say, and competence in being able to use a platform like SimEPR.
And you said that you're using multiple bays, you're using this for, you're having multiple students in a scenario at the same time. So are you using the SimWard functionality to be able to control that? And is having that central overview of what's happening really important to you?
Yeah, absolutely. So how I did it, I had two, like I say, two bays, and I was running it just purely through SimWard. And I would literally duplicate the bays, so put the same patients in the same bed space, if you like, but in two bays, and I would call it basically like ward 1 and ward 2, you know, bay 1, bay 2, and so then what that allowed the students to do is that they wasn't writing on each other's notes. You know, if they've got the same, you know, Mr. Smith in bed 1 in this bay, Mr. Smith in bed 2, I was able then to manage, you know, which bay was which sort of side of things. So if I would go into the bay, because what I was doing as well, I would act as the ward consultant. So I would go in there with SimEPR on my trolley to like how they do see in practice, you know, them walking around with the ward round with the little laptop and things. So I would go there with my laptop and I would have it open in scenario, like in the sort of simulation mode. So I could like, write my name as, you know, Dr. Patel or whatever I was calling myself that day. And then whilst doing the ward round, I would get the patient's notes up on there to see what they document. And I would say things like, oh, have you put that referral in? Show me where that is. And I would get them to do that. Oh, let's have a look at this morning's blood results, to make it so realistic to what I know of in other trusts of what a you know, what a ward looks like, a ward round looks like, to build them that confidence of actually finding documentation. And I would say to them, okay, can you get the patient's blood results up for me? So then they would find that for me, and I would act as a doctor and then review those results, and then we could discuss it together. So that was really effective to be able to do that and use SimWard in that. And then for me to, what was great about it, where Arron spoke about being able to push results and stuff, they would say, you know, I'd say, okay, can you request this morning's blood? So they would put the request through, and then I could leave the bay still in Sim to keep it really realistic. I could leave the bay and I could see the request come through on the sort of controller mode. And then I could then, you know, send it back to them, and then they would call me to say, oh, the results have come through. Can you come and review them? So it just kept it so dynamic and just so realistic of how it is, you know, in real time. And I would really play it as well, like, well, you know, I'd leave it for a couple of hours before I'd send them the blood results. Does that make sense? To keep it so realistic, and it just allows you to do that. And I don't have to then go and do loads of research, or let me just check what, you know, I don't know, normal platelets are today or whatever. You know, I could just use the magic button and say, make this blood gas normal, you know, make these blood results normal for me, and it would do that. So it just takes so much time, so I could then focus on other things, because SimEPR took a lot of the work away for me.
So would you say that real-time aspect, because it is running in real time, and the fact that you can push results to the students at the time of your choosing really increases the fidelity of the simulations that you're carrying out?
Yeah, absolutely, it really does. And I would as well. So, for examples, because it would be what's really difficult within simulation, and you know, most people will appreciate this, when you've got a mannequin in the bed and then you ask the student to take the patient's vital signs. Well, of course, you have to stand there and say, oh, actually, the heart rate's this, or and so what I would get them to do would be to practice on their friend, so they're still doing, you know, the taking blood pressure or whatever. And then I would then go and push the OBS onto the SimEPR, so they would get them that way. And you know, then we would talk about, and what was great is you could pause, and like Arron showed you, like where the new scoring was and stuff. And then what I would do, I would sort of pause the scenario for a moment and go, okay, actually, because especially for my stage 1 students, okay, right, let's have a think about new scoring then. When do we need to escalate? And it's all that. Them getting used to noticing trends and stuff like that was really useful. So yeah.
So can you use it almost then as a sort of formative assessment, that as they're doing it, because obviously there's what Arron showed us, you can have the printout afterwards, the PDF to show exactly what the students have been doing and interacting with, but it sounds like you're using it as a way to almost assess the students as they're doing it and seeing what they're noticing and what they're spotting as they do it.
Yeah, absolutely. So like I said, I've used it main way I use it is with SimWard, but recently we had a bit more of a smaller scale SPL day. So I did use it in scenario mode where I just had the one patient. And what I got them to do was we were focusing around that sort of AE assessment and being able to document accordingly and making sure that our notes were clear. So I got them to use SimEPR, read up about her, look at the nursing handover from the day before, and then I would get them to write in sort of AE assessment, and then they submitted that to me separately from reviewing, you know, going able to find out where the different results are, see what the physio said that morning, and even things like that. So creating the physio notes, like the use of AI and stuff like that is fantastic to incorporate into SimEPR. You know, we would sit there and go, all right, we've got to do a physio assessment. Well, I'm not a physio, I'm a nurse by background. So we'd go, right, what the physio say? So we used AI massively to help generate those notes and stuff as well. And then we would get those students to review those notes and then practice writing AT assessment. Okay, so what did the physio said? And we used it as well when they were doing handovers, because another thing that practice partners will tell you that students aren't very confident at handing over, hearing their own voices. So we would get them to do that from SimEPR as well. We would do like, oh, the night team come in right now, hand over. So they'd have SimEPR in front of them and go through the patient's notes and hand over a full assessment of that patient. So again, really effective tool to use it in that way.
So as you said, you've got it on quite a large scale, doing a full sim or doing a full SPL simulation, and then you can take it down to much smaller simulations as well. You said to me before we started the webinar earlier on that you've only just come off a simulated placement period, so you might still be in a bit of recovery from that. But have you already thought about what the kind of future looks like for future simulated placements with SimEPR, things that perhaps you want to evolve and to develop using SimEPR?
Yeah, absolutely. So like I say, at the moment, we're only using it on the pre-reg nursing students, but it's definitely got more scope for that. And I've just gone and showcased it because my role, I don't just look after nursing students, I look after all healthcare disciplines. So I've just been to show it to radiographers actually, because there is an element where you can, and I showed you upload like sort of chest x-ray images and stuff like that. So they were really interested because again, they have to, you know, release results and, you know, write up their findings and stuff like that. So they're wanting to use it in the scenario mode where they would have a patient and then they could, you know, report back on, you know, chest x-rays and things like that and get used to sort of pushing those sort of results back as well. So that's how my plan is, and also to bring it more into the curriculum, not just in SPL where I'm currently mainly using it. You know, there's so many functions with it, such as, you know, when we're doing more of that sort of primary healthcare stuff as well, you know, referring to, I don't know, district nurses and getting them used to writing like that, because, you know, we can give them a template to write on, but it's not quite the same as how they would actually do it in practice. So yeah, that's how we sort of bring it in, and even into ethics, you know, around data reporting and all stuff like that. There's so much, you know, around healthcare governance that SimEPR can be used for.
That's fantastic. Thank you so much, Lindsay, for sharing your experience with us today. I know we've got a couple of questions in the chat, and there's a couple for you and a couple for Arron as well. So I'll just ask Arron to unmute himself, but I'll just come to the questions for you first, Lindsay. Simon's asked, what staff to student ratios are you working with?
Yeah, so in a bay, so say if I'm talking about how I used it with SimWard, so in one bay of 4, so there would be 4 patients and I had 8 students in a bay. At that point, I ran this over a few weeks. So in one bay, I had one facilitator in there, just one facilitator who would manage SimEPR, but then I would sort of manage, I was more like, I don't know what you want to call me. I was the float and I would come in and act as the doctor and stuff like that as well. So then I was going out as well. So it's kind of like, I'd say 1 to 8 in that, you know, 1 faculty member to 8 students is how, and then myself as float. But I think that was realistic, to be honest, you know, but the beauty thing is about it, you know, if you're doing something like that in SPL, you know, results aren't available straight away. So you had time, you know, I didn't have to go right out straight away and write up my doctor's ward round. I had time, because that doesn't happen in practice, does it? So that's the great thing about it. So yeah.
Joe's asked whether the students are using tablets for their SimWard observations, what kind of technology you're using.
Yeah, I just use it because, like Arron explained, it's so amazing. It's just web-based. I just used iPads, so we just used our SAS our SAS team have like iPads that we use for other things. So it was just a standard Apple iPad. Some students were doing it on their phone as well. I did allow students, if they wanted to bring their laptops in. I try to, again, keep it realistic because not everybody, we know what it's like trying to find a computer in practice. So I did try to say, you've got a couple of iPads and, and I allowed them to go and get a laptop as well. But people were doing it on their phone and they were asking because they got so into it and wanted their note, they knew I was checking their notes. They wanted to be able to go home and do it on their phones. And so they would just go and log in at home and, they'd be on the bus writing their notes up for the next day for handover. So yeah, so that's what we were using.
Just that keen to get involved with it.
Yeah, so keen. So just iPads or anything. It's so easy.
That's great. I know that my colleague Kieran has answered in the chat one of the questions, but Wojciech's asked, this is a question for you, Arron, that what's the difference between the standard and the plus packages, if you're able to explain for us?
Yeah, absolutely. First of all, I just wanted to say thank you so much, Lindsay. It's so pleasing to hear such incredible feedback and to kind of hear how you've been using SimEPR. Absolutely incredible. So yeah, thank you.
Thank you for making it.
To answer the question, yeah, so essentially the difference between the standard and the plus, it's essentially a larger package that also includes SimWard, but allows you to have extra faculty logins and allows you to have extra ward capacity so you can run multiple simultaneous wards at the same time. So yeah, essentially in summary, it's a larger package for larger simulation departments who are looking for a bit more capacity.
So if there are any more questions, please just pop them in the chat. We've got a little bit more time left with Lindsay and Arron just to put them in. I've got a couple of questions I was noting down as I was listening to you both that you might be able to answer for me. One of them was about SimWard, and I think you did answer this question, Arron. But is there a limit to how many patients you can have in SimWard?
Yeah, so each ward can have up to 15 patients, and even though it's called a sim ward, they don't necessarily need to be of the same location. So when you create a sim ward, you can have multiple locations. So you can have paramedics, A&E, AMU, SAU, for example. And then each of those 15 patients can be assigned to various locations. You can even set patients as hidden so that you can then reveal that patient partway through the simulation as well. So they can't be seen by the students, but until, partway through, you can say, oh, they've just pitched up to A&E, and that patient will then show up on the patient record.
Thank you. Lindsay did allude to this in her conversation with me, and it sounds like actually Lindsay doesn't need any because she's flying with SimEPR. But would you be able to explain to everybody what sort of support is available to help faculty get onboarded with SimEPR?
Yeah. So there's always the option of having a call where we go into a bit like a demo like this, but it's a bit more in depth with your team, where we can answer any questions and discuss any specific features you wanted to know a little bit more about. There's also videos that are available within the app itself in the instructions section. And then also when you get set up with an account with SimEPR, I also send over a video, which is a full demonstration of the whole app. So you have a variety of kind of written instructions, videos, as well as the opportunity to have an in-person training session, which not everyone always chooses because they feel quite comfortable using it, but it's always an option if you did want to have that with me. And then last of all, I'm always available to email whenever there are any questions or if there's anything you wanted to discuss.
We know from customers that already have SimEPR, Arron, because he's the developer, is very responsive. I know that a lot of changes and developments have happened with SimEPR in response to feedback from people who are using SimEPR. And yeah, it's great to see how you're developing that alongside with people who are using it in their practice.
Thanks. That's really great to hear. Yeah.
My last question, I suppose, is probably to both of you. So now, Arron, you talked about different kinds of charts and the systems that you can use within SimEPR, and Lindsay's talking about plans for the future. Can simulation centres use this for a multidisciplinary approach where you can have different professionals interacting with it and working with each other?
So from my perspective, it was designed for any healthcare professional. It's not aimed at a specific healthcare discipline. And especially with something like SimWard, it's designed to essentially simulate a real patient record in a real clinical environment that's being used by a variety of different healthcare professionals, and each of which can see each other's notes and observations that have been uploaded. So it's fostering that kind of collaborative, multidisciplinary approach. That's from my perspective as a developer, but interested from Lindsay's perspective as well.
Yeah, no, absolutely agree, Arron. Just a point I meant to mention earlier, actually, when we're saying about SimWard, it is actually what SimWard is, even though we call it ward, you can massively get away from it's also a patient list. So how I've used it as well is, say, for example, for like primary healthcare, so district nurses, that's their patient list. So then they can go in there and go, oh, this is or if you're doing things like outpatient, so we know we struggle to get those sort of placement areas. So again, you know, you don't just have to use it as a ward, like Arron alluded to. And we are actually using SimEPR in a couple of weeks on our interprofessional learning day at Bucks University, which is where we have paramedics on it, physician associates and nurses and midwives and ODPs actually, where it's a pre-hospital, where there's going to be sort of a pre-hospital scenario where they'll be brought into our new A&E department that's been built, and we will use SimEPR in there as the sort of running the A&E sort of recess. Okay, so we'll have these multiple of students from different disciplines using it. And like, you know, the example I gave was when I was acting as a doctor, you know, we don't always need to focus this around HEIs, you know, especially within NHS sort of simulation centres as well. I could have been a real doctor using that. Does that make sense? I could just use it the way I was using it as in simulation mode, and then I was adding my notes as I went along, or I was prescribing things as I went along. You know, I didn't have to, you know, I could have been a real doctor, not a simulated doctor. So yes, absolutely.
Thank you so much. Thank you both for joining us today. I really appreciate you both sharing your time with everybody and your expertise and your experiences. It's been, I'm sure everybody will agree, really, really beneficial. If you require any more information about SimEPR, want to find a little bit more about it, or you'd like to have your own demonstration, my colleague is just going to pop in the chat now an email address, sales@simandskills.com, and you can just contact us and arrange to have an online demonstration where you can ask away. I know in this kind of environment you might not want to ask questions in front of everybody, but yeah, please feel free to contact us. And just one thing to let you know before we go, we've got an exciting new web series starting in 2 weeks' time called This is Simulation. Arron and Lindsay are both hosting an episode with me as part of this series. The series is all about new innovations in simulation, and it looks at some of the really current topics that people are discussing. So things like simulated practice learning, AI in simulation. And our first session is in 2 weeks' time, and it's focusing on some free software that you can actually use to look at patient communication using some very clever software called MetaHumans. And it was a very popular workshop that we had at SimTech Live last year, and we're very lucky to be able to have our host Nathan present that to everybody online. So my colleague's just going to put a link to the full schedule of those episodes into the chat. So if you want to sign up and register for those, that'd be great. And we look forward to seeing you on those if you're going to join us. So thank you very much, everybody, for joining us today. And thank you once again to Arron and Lindsay for joining us. And we'll see you all soon. Thank you.